Hello, I'm Jeff Riddle at the Natural Health Advisor Institute. Thank you for watching part 2 of our interview here with Dr. Kate Naumes in Dallas, Texas. So we're talking about PCOS, Polycystic Ovary Syndrome, and what are some common types of methods or treatments that women have had before they come to you?
Yes, so when women are young and they're diagnosed with PCOS, I most frequently see them on the birth control pill. However, if they are trying to get pregnant, the doctor will take them off the birth control pill and frequently put them on metformin to manage the insulin resistance and the blood sugar control. And then sometimes I see them having tried multiple rounds of Clomid to induce ovulation for trying to conceive. So the birth control pill, metformin, and Clomid are definite treatments I see.
Okay, so that sounds like a lot of artificial hormone manipulation. Is that a good idea?
I don't think it is. I like metformin and I see that being helpful sometimes. But obviously, if you want to get pregnant, the birth control pill is not going to be an effective treatment at all. And if we give women Clomid without improving their symptoms, then they don't have good health going into their pregnancy. And my goal is for that woman to have really good health going into the pregnancy so she can have a healthier pregnancy. So my preference would be to work with her for 4 to 6 months to optimize her health, maybe just get her to get pregnant on her own, but then if not, a round of Clomid can often end in achieving pregnancy with the first round, but she's much healthier going into the pregnancy.
Okay, that sounds like a much better ideology. What other types of specific ways do you support women?
So what I like to do is I have some specific goals in mind with PCOS. Number one is to improve their stress response and to help with stress reduction. The second is to improve hormonal imbalances, of course. And then the third is to improve the insulin resistance picture. So that's the big picture of what I'm trying to do with herbs, exercise, diet, supplements, and stress modification techniques.
Okay. With a lot of, in the natural health world, with a lot of less serious conditions, most people into natural health are pretty intelligent. They like to go and research things on their own and try herbs and supplements on their own. Have you seen any effectiveness with that in this, or is it best to go see someone?
That's a great question. I have really smart clients, and I love that they come in having educated themselves because I believe in client empowerment and client education. And there are some really wonderful blogs as well. But I think that with something as serious as PCOS and as complex as PCOS, it's best to have the guidance of an educated professional.
Okay. And is it just, you mentioned pregnancy a lot and how it relates to that. Is it just pregnancy that it might affect, or other things?
There are definitely other things. You have increased risk of cardiovascular disease long term, certain types of cancer, of course infertility, and then if you do get pregnancy, an increased risk of gestational diabetes. So the things outside of pregnancy are cardiovascular disease and endometrial cancer, because those women aren't shedding their uterine lining as much, is a simple way to think about it.
Wow, so it can lead into much more serious complications.
Right, exactly. But the great thing about it is if you get diagnosed fairly early in your 20s especially, I see women live healthy lives with regular menstrual cycles without being on the birth control pill. And even when women come in their late 30s wanting to conceive, there's still so much that can be done by modifying lifestyle and improving diet and with herbs and supplements.
Okay. So what would you say is your best, most well-researched, most effective, way of supporting women with PCOS?
I love inositol, and there's some really great research on inositol. And in women with PCOS, both if they are obese or lean, because there are women with PCOS that are lean, inositol helps to lower their blood pressure, improve their triglycerides, which is part of that cholesterol panel that can be off when you have PCOS. It may help to induce ovulation. It also improves insulin sensitivity and improves the health of the egg. That's pretty amazing for one supplement.
Okay, well, Dr. Naumes, thank you so much for doing these interviews.
Thank you.
My name is Jeff Riddle at the Natural Health Advisor Institute. Thank you.